and I'm really delighted to welcome you for this very important module on basics of hemodynamic monitoring. We are very happy today to have three very important professors that have really changed the world around the conception of the hemodynamic and hemodynamic assessment in critically ill patients. So I'm sure that with them we will learn a lot. The topics that we will cover today will be the cardiac function essentials, and this will be developed by Professor Susanna Price from London. She has a basic training in cardiology, but she's of course working in the ICU and had a lot of skills in echo, and she really had a very huge curriculum involved in guidelines with the European Society of Cardiology. So she really knows this topic very well and will be very helping you in understanding what are the determinants of the cardiac output, the causes of shock, what are the way to assess the cardiac function, and of course how to treat the cardiovascular dysfunction with vasopressors and artropics with different drugs in this domain. So this will be the first topic that will be covered. Thereafter, we will have really the huge pleasure to welcome Jean-Luc Vincent, who is a professor from intensive care in Brussels, and who had been really one of the key leaders in intensive care. You should know him for sure by the numerous papers, more than 1,400 papers. It was series editors in the New England Journal. Is of course editor-in-chief of several very important journals, including Critical Care, and he will discuss with us the fluid management. And this will be covering very important topics like the SOSD. He will develop this. And also, Professor Vincent will develop the assessment of preload responsiveness, when and how to perform a volume challenge, the adverse effect of fluids, of course, and also how to safely and appropriately use diuretics in the ICU. And then we will end up with Professor Jean-Louis Teboul from Paris. Chairman Brisset, to be more precise, is also a huge expert in the domain of hemodynamics. He has developed several concepts of the heart-lung interactions, how to use this at the bedside to better evaluate fluid responsiveness. And Professor Jean-Louis Teboul will discuss the troubleshootings, and practically he will discuss how to have some guidance in when we face some very important problems like sudden onset tachyarrhythmias, low flow states, oliguria, and this despite adequate therapies with a fluid challenge. And so what can we do in these difficult conditions? This will be the very difficult topic that will be covered by Professor Jean Teboul, but we know that he will be very useful for you because he will try to guide you in this difficult domain and try to make you step one after the other one to find your way and to try to treat these difficult patients in the difficult concept, of course, of COVID in these conditions. And with this, I will end up and I will leave the floor to these experts who will indeed teach you the basics of hemodynamics.